Dear audience, welcome to this special moment. It's me, your host, Rohan Shrestha, and today, to make this a special moment more special, we have got our guest, and to introduce them, they are Professor Dr. Kim Lyerly. He is the Professor of Surgery USA, expert in clinical trials and research, and he is the representative from ASCO. Similarly, we have Professor Dr. Purvish Parikh, and he is the Professor of Oncology India, President of SFO, Program Director ICTW India. Similarly, we have Professor Dr. Kumar Prabesh. He is the Professor of Oncology India, Convener of ICON. Similarly, we have Professor Dr. Baral. He is also the Professor of Oncology Nepal, and he is the Program Director of ICTW Nepal. Let me welcome them. Welcome you all. Welcome to Nepal. Welcome to Himalaya Television. Welcome to our studio.
Thank you very much.
Thank you, everyone. Great to be here.
To begin with, I want to start with Dr. Baral.
Yeah.
Can you please tell us something about the program which you are going to organize? Can you please highlight something on that?
Yeah, from tomorrow we are having 2 days workshop. This is not conference, this is a workshop.
Workshop.
And the name of the workshop is International Clinical Trials Workshop. So this is such a workshop which we are going to organize for the first time in the history of Nepal. Such type of workshop have never been done here. The main objective of this workshop is to motivate the youngsters, clinicians, to go into the clinical trials and research. Because as a science, we should practice evidence-based medicine. So optimize the quality of treatment to give more benefit to the patient, and to make cancer, to give the message that it's a curable disease. Still today, the message is that cancer is not curable. Cancer has no answer. But we want to say that cancer has multiple answers. If cured in time, cancer is curable if detected early and treated early. That message we want to give. So not only from Nepal, from all different parts of the world, the delegates, the participants have come. So far we have approximately 70 to 80 participants.
70 to 80 participants, okay.
And all the experts are from international faculties, from ASCO, from ASCO is American Society of Clinical Oncology. The main organizer is ASCO.
ASCO.
Yes, American Society of
Clinical Oncology.
It's the largest organization globally.
Okay, fine. Dr. Kim Lyerly, he is the representative, the audience. He is the representative of ASCO, and I want to focus more on what ASCO actually is. Can you please tell us something about this ASCO? What is this ASCO? ASCO?
Sure. Well, thanks for your hosting, and it's wonderful to be here in Nepal. ASCO is the American Society of Clinical Oncology, and oncology is really the study and the treatment of cancers, and these include cancers of the bloodstream, like leukemias and lymphomas. But as we heard earlier, the sense that cancer is a death sentence, we know that's not true. In the United States, over the past 20 to 30 years, for example, in childhood cancers, where 80 to 90% of children would die 20 to 30 years ago, now 80 to 90% of children are cured of their childhood cancer. We're seeing similar advances in the treatment of many common cancers, including breast cancer, where the vast majority of people treated in the U.S. for breast cancer have a terrific outcome, have a very, very long-term survival. And we see that the opportunity to bring that type of treatment to patients all over the world by working together, by teaming up, by educating each other, is really the opportunity that ASCO and many of the colleagues around the table represent. This sense that working together, we not only do we learn from each other, but we find new ways to improve our treatment for people around the world.
Okay. Dr. Parikh, I want you to focus on the SFO, what actually SFO is.
So, SFO stands for the South Federation of Oncology. As you know, in our region, we have 8 countries which have limited resources. And we need to find unique solutions to solve our cancer problem.
Okay.
For instance, Nepal has 40,000 new cancer patients every year. But if you look at all the 8 countries, then we have almost 20 lakh new cancer patients.
Only in the SARC countries?
Only in the SARC countries. And today, because they are not optimally treated, 3/4 of them are not getting the chance of getting cured. Right? Now we have the knowledge, we have good doctors in SAARC region, but there is a mismatch into what the facility is, what the infrastructure is, and how the patients are treated. So is there a way of increasing the ability to use the existing knowledge and cure a larger number of patients? So that training is required, and that is what we do.
Okay, fine. Dr. Kumar Prabesh, I want you to focus on your organization. What is ICON, ICON actually is?
ICON is Indian Cooperative Oncology Network. In fact, I will take it from where Dr. Parikh said that in this region, and as it is the Indian organization, the cancer patient and the kind of cancers we see in this region and in India is a bit different from what we see in the Western world. So what we need to do is we need to have our own solution for our own patient. For example, if we take oral cavity cancer is #1 cancer, or head and neck cancer is #1 cancer in our country. That is not the case in Western world.
Oral cavity cancer.
Yes.
It's due to maybe tobacco chewing and all.
Now this is a big problem in India. So what was done? A group of people, they did a study to see the screening. That kind of screening for oral cavity has been done anywhere in the world. And they found that simple screening of examination by any graduate can decrease the mortality of the patients because of this cancer. Similar thing, for example, head and neck cancer in oral cavity, we usually have our patients very big lesions like T4 tumors, which is really big. And usually surgery is the treatment, and which is usually not possible. So again, this is something which we again did in India, try to see can we give some treatment like chemotherapy and then resect them, and we could resect 40% of those patients. So there are multiple examples which we will discuss subsequently, but we'll say idea is to have a group of doctors from India where they try to see which is the problem which we face in India as far as this cancer is concerned, and can we give the solution to our patients there. Another example which I will like to mention, because it also involves ASCO. This was a study done in screening in cervical cancer by Indian doctors, and that was visual examination, a simple test which can be done easily. The cost is far less than the regular test, what we call pap smear, and this was a positive study that decreased the mortality, and in fact that study was accepted in ASCO in a plenary session last time.
Doctors, we will be focusing on this, the different types of cancer as well. But before that, I want to just focus on what kind of the significance of this program which is going to be held. Can you please, Dr. Parikh, can you please highlight something on the significance of this program which is going to happen in Nepal?
So in Nepal, if you look at the number of doctors, there is less than one doctor for almost 100,000 of your population. Now, what we have thought is how to make their work more efficient, and therefore we invited applications, and we did a screening process to identify who is most suitable to learn best about how to do local research in cancer with international standards. So there will be the best possible research for addressing the local needs. And we have now selected we had more than 3,000 applicants. Of that, we have selected 80 people who will participate in this workshop. And they will be given hands-on experience, really very intense experience on how to convert a thought process, a hypothesis, into actually a research project. And then they can do that in such a way that it benefits hundreds of thousands of people, not only in Nepal, but across the SAARC region.
Dr. Kim, I want you to highlight some more on this, the significance of this program in the country like ours, in the developing country like Nepal.
Sure. Well, one of the things that we understand is that medicine is an evolving science. And as we apply what we know about medicine, we have to be open to learn from our patients, we learn from the communities. How do we improve on what medicine we're delivering? If you look in the United States, the 50 best hospitals in the United States are all research hospitals. They all have high quality patient care, but that high quality care is combined with research where doctors are seeking to find ways to improve what they're doing. And I think we're trying to establish that same type of balance here in Nepal, where the quality of the doctors individually is extremely high. The people are very talented, but the infrastructure and the ability and the capacity to do clinical research may not have achieved its full potential. So I think by starting with young physicians, young clinicians, young surgeons, we can establish a culture of not only providing terrific care, quality care to individual patients, but we want them to begin to think about improving care for individuals and improving how care is delivered in Nepal.
Dr. Kumar, what is cancer? Can you please say something? Can you please define cancer? What is cancer and the types of cancer which we are focusing on?
I'll say I won't go to the technical definition. In general,
So that the public can understand.
So if you have cell in a body which is regulated the way it divides, so if it goes haywire, it starts dividing on its own without any regulation, without any regulation to it. That is what I'll say is cancer, because cells divide and it is not getting regulated. That is, in general, the understanding of cancer. Now, which are the cancers which we usually talk about? In general, in this region, the commonest cancers are, like in male, it is usually lung cancer and head and neck cancer. They are common. And in female, it is breast cancer and cervical cancer. They are common. But apart from, there are some cancers which may not be the commonest one, but majority of patients, they are contributed from this area is like gallbladder cancer, which comes from this region, primarily the Ganges belt.
In the region like South Asian region,
yes.
Nepal and India, Bangladesh and all.
Yes.
Okay. So, Dr. Baral, what kind of cancer is seen in our country?
Exactly, population-based data we don't have, but our study and our hospital-based data shows that lung cancer is the commonest cancer amongst male and female.
Both. Since
Because
both
of high smoking.
Both in Nepali society, both male and female, they smoke.
Smoking prevalence is very high. So, and second, cancer depends from institute to institute. Like where I work, GI cancer is more common. In Bharatpur, oral cancer because of tobacco chewing is more common. But if you see for the females, cervical cancer, cervix cancer, not uterus cancer. Always people are confusing between cervix and uterus cancer. The cervix cancer is the most common cancer, followed by breast cancer.
Dr. Baral, can you please say something about the cervix cancer and the uterus cancer so that people can know more about it?
If you permit,
yeah, you can definitely you can tell that in Nepali.
पाठेघरको क्यान्सर धेरै कमन छ भने पाठेघर होइन पाठेघरको भनेको चाहिँ युटेरस भयो सर्भिक्स क्यान्सर सबैभन्दा कमन सर्भिक्स इज ओपनिङ अफ युटेरस त्यहाँनिर चाहिँ धेरै क्यान्सर हुन्छ पाठेघरमा होइन कि ओपनिङ अफ सर्भिक्स युटेरस सर्भिक्स क्यान्सरमा
के कारणले गर्दा फेरि यो भयो
यसको त धेरै कारण छ अब अरु कारणमा सानो उमेरमा बिहे गर्ने चाँडै बच्चा पाउने मल्टिपल पार्टनर आफ्नो गुप्ताङ्गको सरसफाई नगर्ने यी सबै आदि इत्यादि कुरामा पनि अहिले के प्रुफ भइसकेको छ भने सर्भिक्स क्यान्सरमा एउटा भाइरसको ठुलो रोल छ ह्युमन प्यापिलोमा भाइरस सो त्यो ह्युमन प्यापिलोमा भाइरसको इन्फेक्सनले पाठेघरको मुखको क्यान्सर भनेर अलमोस्ट प्रमाणित भइसकेको छ इट्स अलमोस्ट प्रुफ नेपालमा त धेरै कमन छ
How do you analyze this?
Well, one of the things that we know is that cervical cancer in large part is due to an infection and that infection was shown to cause cervical cancer by Dr. Schuhausen, who won the Nobel Prize for that discovery. If we know that an infection causes it, there in fact is a vaccine that will prevent that infection. And so we are hoping that we are in an era where perhaps the cervical cancer is the most common cancer in Nepal now. If we can screen it using high efficiency, low cost techniques, as we've heard from others, and then eventually we develop plans to prevent cervical cancer by preventing HPV infection. We can imagine that we'll have a situation where a few years from now, when you have grandchildren, perhaps we'll talk about the history of cervical cancer in Nepal. We'll think about that, and that's the opportunity. By working together, by educating, by doing research, we can implement plans to control cancer by early detection and prevention.
So what is your opinion on it?
So let me give you a broad example, and I think it's very important for the audience. What is the meaning of cure? In medicine, cure means that there is no sign or symptom of the disease, there is no treatment required, and the patient's lifespan becomes normal. If you take all these three features, then cancer is one of the few diseases which can be cured. Diabetes, lifelong treatment, no cure. Heart ailment, lifelong treatment for blood pressure, no cure. Arthritis, joint pain, renal failure, same thing. But cancer is curable. Actually, people can get the right treatment, disease can totally disappear, and they will go back to normal life in society. We have had girls who came when they were young, got cured, got married, now have children of their own and are leading a normal.
So it can cure totally.
Totally we can cure if we do the right research and if
But there are plenty of examples in our society that once the cancer is cured, then again it gets chances to, revive. It's in some other parts of the body the cancer is seen. What is the main reason behind this?
So it is true that cancer can come back or a second cancer can develop in some patients. Those are the patients who are not cured. But I am referring to patients who will never have the disease back. They will have totally normal life if they are treated properly and in time. That is the most important thing for us to understand. If you have an infection, like a common cold, it can be cured, right? If you have some vitamin deficiency, you give some vitamins for a few days, you're cured. So also cancer is to be diagnosed correctly, given a short-term treatment, and after that no further treatment is required and the patient can get cured. This is what we need to focus on.
But there must be, diagnosis process must be proper.
Correct.
Dr. Baral, do you want to add something on this?
Again in Nepali.
Definitely.
पहिला ट्युबरकुलोसिसले मान्छे कति मर्थे नेपालमा के भयो भन्दा टिबी भयो
मान्छे मरे
Now tuberculosis has no problem, it's 100% curable. ATT, anti tubercular treatment, DOTS program आयो अहिले टिबीले मान्छे मरेको भनेर हामी कमै सुन्छौँ. क्यान्सरको फोबिया आयो, क्यान्सर अहिले भने जस्तो क्यान्सरबाट रोग निको हुँदैन भनेर. तर डाक्टर पारिकले भने जस्तै treatment on time, early diagnosis. Early diagnosis is very important. In Nepal, still 75-80 to 85% patient comes in advanced stage.
That means
not almost
awareness level छैन.
Yes,
we don't have that awareness level. What about in India?
So we have a similar problem, except the proportion is different. And I will put some number to it, and absolutely they were all very valid points. Like if you take in Western world, overall, out of 100 cancer patients, almost 70, they get by and large cured. If you take India, today also out of 100 patients, almost 30 to 35, they do get cured. So that what it means that we need to do many more things, from prevention to early detection to treatment, which is widely available, widely acceptable, which we can try to develop in a way so that it is possible for people to take it in these kind of circumstances. And that is why this kind of workshop becomes very important. We have also in the past benefited with this workshop in India, and I am sure Nepal also will be benefiting.
So, Dr. Kim, do you have any suggestion that how can we aware?
Well, one of the successes for Nepal is the fact that the life expectancy has increased, and so that's terrific. But one of the challenges is as the population gets older, they increase their risk for cancer. So the challenge is as the older we get, our bodies are more at risk for cancer. There's no question that the first thing you would want to do is try to reduce those preventable causes of cancer. Number one is tobacco control, to try to reduce cigarette smoking and cigarette tobacco consumption. Challenge around the world, India, China, US, still we have 40 million people in the US that continue to smoke. So again, still a challenge. Prevention of infections that can cause cancer like HPV, hepatitis, etc. Those are clearly there. And I think one of the things that's really important we heard today is really to get the message out that early detection and treatment can result in treatment that allows an individual to maintain their lifestyle, to have a normal life, to have normal function. And we have a new culture in the United States called survivorship. in which people get treated and cured, and they are very proud, they're very open, they're very welcoming. And I think that sense that you can have cancer and be very open about it and be an example of successful treatment, that is extremely helpful in making people aware and comfortable in getting the right treatment.
So do you have some data regarding this? Do you have some record regarding the cancer patient in USA per annum?
Yeah, in the U.S. there's about 1.5 million cases of cancer. Still, about 50% of people with advanced cancer, particularly of diseases that we call intractable or refractory cancers. One cancer in the United States is very, very tough, is pancreatic cancer. And this is one where it's very unlikely to have a long-term survivor. And there are many people working on the problems like that. But for the common cancers like cervical cancer, there may be 10,000 cases per year, and the vast majority of those are cured. Breast cancer, there's probably a 85, 90, 95% 5-year survival rate after initial treatment in the U.S. So again, very, very dramatic improvements, very, very widely accepted therapies that are easy to tolerate, and people accept very, very well. So I think we see examples that common cancers can be addressed, and then cancers unique to a region, like head and neck cancer, cervical cancer, here need to be addressed within the culture of the country.
Dr. Parikh, you just gave us the scenario of USA, and can you please compare that with the SAARC countries?
So most important thing I feel for our countries is that there is a common lifestyle for many non-communicable diseases. So cancer, diabetes, hypertension, paralysis, all have a common lifestyle. So if you have good exercises, proper diet, lack of obesity and lack of tobacco, only 4 things that you change your lifestyle, half these diseases will disappear.
Dr. Baral, can you please highlight something on the awareness level of our country? कस्तो छ awareness level?
पहिला भन्दा त बढ्या छ. पहिला त केही पनि awareness थिएन. अहिले पनि still many people feels that cancer is a communicable disease. And burden of communicable disease compared to burden of non-communicable disease, so burden is more in non-communicable disease, like as Professor Parikh mentioned, diabetes, heart attack, cancer, whatever, kidney. त्यसैले awareness level पहिला भन्दा बढेको छ. तर still many people नेपालमा के छ भने if you have cancer सर्छ भन्ने छ.
के गरिनुपर्छ?
क्यान्सर सर्दैन भन्ने मेसेज हामीले दिनु पर्यो.
डाक्टर बराल, त्यसको भूमिका कसको हुन्छ, के गरिनुपर्छ?
सबैको हुन्छ. नेपाल सरकारको हुन्छ, इच एन्ड एभ्री एनजिओजको हुन्छ, हरेक डक्टर्सको हुन्छ, अन्कोलोजिस्टको हुन्छ, र मेडिकल प्यारामेडिकल स्टाफ ग्रास रुट लेभलसम्म सबैले यो मेसेज दिन सक्नु पर्यो कि क्यान्सर सरुवा रोग होइन, सुरुमा गरे क्यान्सर निको हुन सक्छ भन्नको लागि हामीले वर्कसपको आयोजना गरेको. त्यहाँ हामीले ग्रासरुट लेभलको सबै डक्टर्सहरूलाई कसरी रिसर्च गर्ने, कसरी ट्रायलमा जाने र कसरी पेसेन्टलाई बेनिफिट गर्ने र अल्टिमेटली क्यान्सरलाई क्योरेबल बनाउनेमा हामीले वर्कसप गर्न लाग्यो.
Well, we have come to an end of this program, but before wrapping up, I want to take a prescription from the doctors. Dr. Kumar, can you please highlight something so that our audience, they can know more about cancer? What can be done, a prescription from a doctor?
So best thing to do is to prevent, and the best way to prevent is not having tobacco, and second, a healthy lifestyle. 2 important things. If we do in our region, we will be having almost half of the cancer gone by and large.
Dr. Kim, to our audience.
Well, I think the lifestyle, the healthiness, the quality of the diet in Nepal should lead to enhanced life expectancy, and it has. We want to just make sure that we promote the healthiest by, and again, I think tobacco control is the biggest single message you could give to the region.
Thanks, Dr. Parikh.
I would tell the audience that if ever you're diagnosed with cancer, please trust your doctor and complete the intended treatment. Most patients are not cured because they stop the treatment in between. And that means half treatment is like no treatment. So
Dr. Baral,
must
okay.
trust Dr. Baral and make sure that they complete the treatment.
Definitely. Dr. Baral, one-liner in Nepali.
cancer is a preventable disease. 40% cancer is preventable. Change in the lifestyle, you will be cured.
I want you to tell something in Nepali so that our
क्यान्सर सरल रोग होइन, यो रोग लाग्न साथ मृत्यु हुँदैन. अरू रोग जस्तो सामान्य यो रोग निको हुन सक्छ, तर सुरुमा पहिचान हुनु पर्यो.
Well, thank you so much, doctors, for this wonderful time and your valuable opinions.
Thank you, Rohan.
Thank you.
Pleasure to be here.
Thank you very much.
Thanks to you as well, the audience, for your time. Keep watching Himalaya Television. Do stay with us for more news and entertainment packages.